first question I would like to ask you, what has your overall experience here in Rwanda been so far?
I have to say the experience has been really, really good. I feel very, very welcome here. And the team here are very friendly. I feel like even after a couple of days, I feel like it's my family. They're very, very friendly. And I spent quite a bit of time in the clinic, seeing quite late presentation glaucoma, and a lot of the patients are presenting with end-stage glaucoma and with complications already. So that's one thing that's very different from where I came from in the UK, where patients a lot of the time come in from, they get referred by the opticians, and the glaucoma tend to be very early, hopefully, most of the time, early or moderate. Whereas in here, I noticed that there's a big difference. A lot of patients come in late presenting glaucoma and have complications such as vein occlusion. The experience otherwise has been good. I was spending a lot of time in theatre, and I managed to show some of the doctors how to do tube shunt surgery, and also some angle surgeries as well, and trabeculectomy. So that's been a very nice exchange with the local team in terms of experience. Yeah.
Today, you read the training focused on glaucoma. Why this area is so important? Like, you have also been in training last week. It focused on like a theory. Today it was like practical, more practical. Why is it so important?
Yeah, it's very important here because glaucoma in the region in Africa is one of the highest cause of blindness in Africa. The world population, the most glaucoma come from this area, and the most challenging to manage glaucoma as well. And I'm very, very happy to see that the team here is working so hard at not just facing their challenges or managing the most complex and most advanced glaucoma, but also they are starting to look at managing glaucoma and picking up glaucoma at the much earlier stages. So the talk last week was mainly focusing on management of glaucoma in general, and also how to pick up the early signs, symptoms, and with the more advanced tests that they have here now, to pick up the very early glaucoma. And today we have the opportunity to go through the gold standard of trabeculectomy, which is something that's really important. Even though with advancing different technologies that we have these days, there's a lot of different kind of surgery. Glaucoma surgery, such as trabeculectomy, like this, is still the gold standard. It's still the best surgery, even though it's one of the oldest. But it's still the best, so it's very important to do it properly, and to have my colleague here that share experience, so that we can advance the care in glaucoma in the local region.
What skills or knowledge do you hope you have imparted to the participants?
Yeah, I would say that learning is both ways. I also learned a lot from the team here as well, because the team here has a lot of experience in managing advanced glaucoma at presentation. So here, I felt that what I can share most is to pick up glaucoma earlier, and using the tools that they have here, picking up the early clinical changes in the optic nerve, or picking up some OCT scans that I've talked about last week. And also I shared how I was taught in doing trabeculectomy. There's many different ways to do it. So it's nice that the team here maybe can see what we do in the other side of the world. Like in UK, I use Morpheus-safe surgical technique for trabeculectomy, which helps to try to reduce the risk of hypotony, which is one of the complications that we all want to avoid. So I'm glad for the opportunity to share that here. And also at the same time, I'm learning from the local team how they do their technique here.
Based on what you have seen, how do you assess the level of glaucoma care in this region, I mean in Rwanda, or particularly in Kabgayi Eye Unit?
Yeah, I think the management is great. The patients that are diagnosed, most of the patients are presenting late. And so once they are diagnosed, most of the time I can see that they get surgical treatment very immediately and very straightforward, almost on the same day or the next day, which I have been very, very impressed with. And I have to say that I'm impressed by the assessment and the management that are delivered by the team over here. So, and they are focusing on, they have the challenge of facing the advanced glaucoma, but also they are pushing themselves forward to try and pick up the early glaucoma as well. which is it's been very good. Yeah.
What is your impression of equipment and all facilities
Yeah.
available at Kabgayi Eye Unit?
I have to say again, I'm very, very impressed. I had to look at the visual field machine and the OCT machines that they use here, even the microscope that we use in theater. They're all very, very, very good tools that have, and also not just tools. I have to say that the skills that the team here have demonstrated are also very good and impressive, and even the facilities in simulations that you have here, they are all state of the art, very, very good facilities. And I can see there's a culture of keep wanting improvement and culture of wanting to move forward and improvement in this place. And not just that, they have the culture of wanting to improve and culture of learning from, and they also have the culture of sharing what they have, which is really, really nice. And yeah, it's very, very good. It's been really, really good.
Are there any areas you see
Yeah.
like you feel they need to improve or that need more support?
I think it's they have the technology, they have the patience. I think one thing that can maybe one thing that I can think of is that because you have the technology, you have the patients populations, and they have the right attitude to improve because they always wanting to improve. One thing that they can use all this together is to maybe collect data. If they use the opportunity to collect some data of the patient they've seen and patient they operated on and the technology that they use, because we don't have a lot of research and public and good evidence coming from this part of the world. So at this unit is special in the way that you have a lot of tools and you have a lot of experienced doctors as well, and very keen people. So if you can collect data of the local population of the patients, I think that will move the department forward a lot.
Yeah, we are approaching the end of our conversation,
Yeah.
but before we end this interview, I would like to ask you, do you have any plans to return back to Rwanda?
Yes, I would love to come back.
And the last question, just give the message, or what the message would you like to give them to live for eye care professionals in Rwanda?
I would say specifically for this unit, I haven't seen other units, is that just keep doing what you're doing. Honestly, I have been really impressed, and I really like that the team here, they really put patients at their heart. And I think that really touched me a lot.
Yeah, thank you so much for your time.
Thank you.